Vietnam. Yeah, 1968 is the time. Okay. What was she seeing? What was she doing?
Blood on the floor.
Okay, so there was blood on the
Corpses.
bodies in there. She kept saying there were corpses. Okay. She was talking to the charge nurse, who was not there. Correct. Yeah. What else? Anything else?
She had a little bit of manic behavior.
Okay, tell me more about that. So what was she doing?
Making the bed, making the bed, making the bed, making the bed, making the bed.
She had a very hyper fixated focus, right?
Mhm.
Of her agenda, her plan, for sure. What else was she doing?
Peeking out the door, out the door and the window.
Paranoid. So yeah. So what kind of led you to believe that she was paranoid? She was peeking at the door.
Talking about Charlie shooting.
She was talking about people shooting. There was helicopters coming in.
There were going to be a bunch of soldiers.
She's getting ready for the bed.
Mm-hmm.
She's training us.
She was training, yes. What kind of signs or symptoms or feelings, emotions do you think she was experiencing, or do you feel like she was demonstrating? Okay. How do you feel like she was showing anxiety?
The pace of her voice, she was talking so fast. You could barely keep up with what her next thought was going to be or what she was going to say next.
Yes, totally, for sure. What else?
Even just the way she just was moving around the room was pretty hurried.
Yeah.
Lots of fast movement in her hands and things like that.
Very good.
The alcohol and the cigarettes seemed like a coping mechanism.
Yes.
She did have the alcohol and the cigarettes, yes. So again, that was a big safety concern, right, for her. What other kind of big safety concerns did you notice?
She left the door.
She left the door.
Oh, she could have just gone.
She could have escaped, right? Yeah.
She could have also blacked.
Right. She could have
I'm
also
sure it was like right beside the door. I'm like, oh.
There was an IV pole in there, but she wasn't hooked up to anything.
There was an IV pole. I think in a real life, if we were in a sim hospital, which the scenario was, you may not see an IV pole. But if she was a schizophrenic or a patient that had schizophrenia and it was in an acute care hospital, you would see an IV pole, typically, especially if it was in use. Maybe if it wasn't in use, it would be a good idea to remove it, right? Because that is kind of a safety concern.
And the sheets.
Yeah. Yeah, the sheets.
A lot of stuff in there.
Yeah, there's a ton of stuff in that room. What kind of thoughts in your head did you go through to kind of keep yourself safe as part of the scenario? So staying by the door.
So yeah, like maintaining the safety distance.
Okay.
not taking your attention off the patient.
Very good. Yeah. Yeah.
Noticing any depression and anything.
Yeah. Yeah.
Don't let the patient get behind you.
Yeah.
Keep
Don't
her
let
back
her
too
get
long.
behind
Always
you.
keeping her in front.
Yeah.
Made sure to ask before touching what she was doing.
Yes. Asking permission so that way she felt, you were respecting her space, right? Susan? Good. Those are all really good things. So what were your guys' kind of feeling during the sim? So what were you thinking? What were you feeling as it was going on? So let's just start kind of in the beginning. So when you're first walking in, what were you feeling, thinking?
I didn't know she was
Yeah.
recording for
Yeah.
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 Because I didn't see her when I first walked
Yeah.
in.
Okay. She was looking out for the Charlies.
I was peeking. I was like, when the moment you left me, I saw her. I'm like, is this how it's supposed to be? Is she really peeking out at me? I'm like, is she just watching her?
Yeah, so lots of anxiety, a little bit scared, a little bit unsure maybe about, where is this gonna go? When did your kind of attitude or feelings or thoughts kind of shift, if they did?
When she didn't, yeah, and she,
Okay.
when I asked what the charge nurse was telling her, and she just wanted to help people, and then I asked her, like, do you want to hurt yourself or others? And she, was like, no, I just want to help. I was like, okay, we're safe.
Yeah, yeah, kind of helped you breathe a little bit.
Like she stayed, I don't want to say she stayed calm, but she didn't get irritable at like any point. Like we were able to ask her anything, and she pretty much answered whatever we asked her.
Yeah.
But she still went back to her own thoughts and doing what she wanted to do. do. So that kind of made it a little like, okay, well,
Less.
at least I know she's
Yeah.
not gonna try to, well, she didn't say about her, so I can't say, I don't know, she's gonna try to escape.
Yeah.
But it let me know she's not gonna harm me, so it made me
Yeah.
feel a little bit more comfortable.
For sure. For sure.
I think for me is when I got to understand what's going on in her head, like where we are, like being
Right.
she was a nurse and everything, so that's when I understood. When I understood is when I was
Nervous. Yeah. And then what about when you were leaving towards the end of the sim? What were your thoughts?
She walked me to the door.
Yeah, she walked me through the door.
Yes, a lot of people got escorted out of the room.
For me, it just went on and on, so it's like we're really sure, like,
Yeah.
and it just sort of started to like repeat, if you will.
Right.
Yeah.
So when you did kind of feel that way, did you feel like, okay, I have the assessment data that I need? Or, when you left and maybe were reflecting a little bit more, did you feel like maybe you had the assessment data that you needed at the moment, but then when you reflected, be like, oh, I could have asked this, I could have done this? Yeah.
I feel like I had everything, but then I forgot when I got out. Like it was going so fast that whenever I came out of the room, I don't remember what her response was to this.
Yeah.
I felt like she kind of dictated the whole experience. Like I kind of feel like I kind of followed her lead. And so when I stepped out, like I said, she walked me to the door. So when I stepped out, I kind of felt like, man, like, did I even have any control of this whole experience? Like I felt like she
Sure.
kind of dictated.
Led
like,
you, yeah. Yeah.
Same.
Which is a hard place to be, right? Because we are there trying to do a job, and when our patients aren't necessarily allowing us to do that, it can be frustrating. So it can be very easily to get frustrated. I don't think any of you guys, at least on the outside, showed frustration, but I could understand where that feeling may come from in this, scenario where maybe you were not getting what you thought you were gonna get, as an end result in the sim. So, any other thoughts about that? Did anyone think that they did anything, or what do you think was the most helpful or most therapeutic in de-escalating the situation with the client?
Questioning her a lot on her hearing the voices.
Okay.
Or not like, no, there's nothing there, like being negative towards that.
Yeah.
And just being gentle, like
Yeah.
gently try to tell her, but not argue with her. Like there's no body in here, there's no blood.
Right.
I think like when you're inquisitive of what's going on, like, you're making a bed up for your soldiers, or how does it feel to serve the military? Like she told me she felt honored. That's what she was like, calming down.
I feel like about half of you got the patient to sit down or asked the patient to sit down. So those of you that did, why did you make that decision? Like, why did you decide to do that?
She was running around so much.
Yeah.
It was a lot.
Yeah. Yeah.
I feel like she was just you were trying to ask her stuff, and even though I went along with like the bed making, I was like, she's still like she's so focused on the corner. And I'm like, that's actually. Do you want to take a break? You want to take a minute? You're working so hard. We're working so hard. Should we sit? She liked that, but.
See, Neil over here, and I encouraged it. I'm like, oh, you're doing such a good job.
Yeah.
I started trying to, like, she said, like, get her to sit, like,
Right.
distract her, have her,
Yeah. Yeah.
It makes me feel better. She only sat for like 2
I was
seconds, and
gonna
then
say,
she
oh,
was
yeah.
on the corner, and she was like,
Not
she
hard,
said my corner is where it is.
Does anyone kind of in hindsight think that they could have done anything else to try and de-escalate her?
She needed
I
meds.
think she would have tried communication.
Yeah.
No, because she was extra frantic. You have to wait till her energies
Came down a little bit, right? And so like you could try things like deep breathing or, just kind of other
I feel like that would have made her sad because she was so like focused on the thought that she needed to get ready for something. I feel like if I'd been like want to deep breathe and she's in the middle of making her bed, she's
Right.
gonna be like,
She has like,
What are you saying? Yeah.
The helper's
For sure.
coming in 10 minutes, and she's like, they're coming.
Yeah. So like some of the techniques that we have in our toolbox may not always be helpful, right? Sometimes they're worth a try. Sometimes you're like, oh, this is never going to work, so let me just move on to the next thing, right? How do you feel like your verbal therapeutic communication went?
Better than the depression.
Better
Okay.
than the
Right.
Okay. A lot of you guys said that. So what about it felt better? Or what do you think went
She
better?
gave us more.
She gave us more,
Yeah.
right? There was more to work with.
Okay.
Then, like in the depression one, it was, a patient, very introverted, crying, right? Like this was more engaging that there was actually something going on in the room that I could go off of and ask
Yeah.
the question.
They were like on two different spectrums. Like one is literally just going through such bad grief, it's like she dissociated and she's like not even really there. But this one's like in a whole different moment. Like
In
she's
action.
living, she's living in action. So
Yeah, for sure. For sure. And I think because she was so in it, even when you guys did ask closed-ended questions, she was giving you more.
Yes.
She was able to
Yes.
give you more information, so that, I think that also helps kind of keep the conversation going and give you more information than maybe you necessarily asked for, right? What about nonverbal? So what sort of things did you do for nonverbal communication?
Facial expression.
Good facial expressions or bad facial expressions? Okay, tell us about it. So lots of, raising eyes,
Nodding the head.
good nodding the head, like we're listening to her, right? What else?
Good eye contact.
Trying to get eye
Not
contact.
listening to you.
I don't think I could get her to look at me once.
She was now giving you eye contact. You could try, right? Yeah.
And I kind of stayed facing her, like when she was coming around, like trying to continue to like be engaged without being
In
engaged.
her space
Yes.
too much. Yeah, for sure. Very good. Do you feel like her anxiety or fear was validated when you were in there with her?
Yes.
Yeah. Yeah, like her delusions, her experience, and what the voices were telling her, and her reality was her reality. And so, so making sure that we kind of recognize those emotions that also go along with the delusions that she's feeling and experiencing. Does anyone think that they unintentionally escalated the situation at all by saying something or doing something, or even maybe potentially could have escalated the situation by what you said or did?
I feel like at one point I could have done that when I think I said something to her about the bed looking fine. No, I'm sorry. I asked her if she wanted to sit on the bed after we had just made it. She was like, no, it has to be clean. And it's for the soldiers. So I feel like that could have gone a completely different way because she was so focused on the bed and making sure it was neat and clean. So that could have agitated her.
Even what you set up first, where a lot of you, I think, said the bed looks great, and she's still there trying to like make it perfect. So if you kept saying that, that could have for sure made her more agitated. So I love that you said that.
asked her a lot of questions, and then she goes, "You're asking me so many questions." So I just had to I just told her, I was like, "Well, I'm trying to learn like I'm new." And then I'm like, "Well, she thinks I'm a trainee. I hope she like takes it easy on me then." Or she like yells at me.
Yes, yeah. So sometimes that's when we utilize our silence a little bit, break up the question so that our patient isn't getting super annoyed with us. What else?
I think I had asked something too when she kind of like was frustrated with me because of what I had asked. It was like the soldiers were coming and like, but she went back to like, okay, you're new, so
Yeah.
kind of let it go.
Yes.
She was talking to a charge nurse and she was like, they said no help. No help at all. But it's okay, I got it.
Yeah, she's new. She's new, I know. Well, I think I mentioned in a couple of our individual debriefs when she is talking to the voices, allowing that to be a time where you're silent, so that way, if you're talking to her and she's having another conversation, that also could potentially escalate her, right? But then also, if you are silent, that allows you time to hear what she's responding and just kind of observe and think about, okay, how am I going to ask her what these voices are telling her? as opposed to just kind of go, which sometimes we tend to do, right? I forget who told me, I think it was you, Kathy, where you're like, I said a question and then I didn't even give her a chance to answer before I immediately said a question. That's annoying for anybody, right? That's, if we're like putting words in her mouth, those types of things. So just kind of being careful with our communication. Any other thoughts? Okay. What did you find most challenging today?
The alcohol, cigarettes.
I know, right? Taking that away.
Yes, it's a curveball for sure in the sense.
Oh yeah.
Yeah.
I
That-
wasn't
think
sure
that was the
if
first
I
time
could
I
remove it from her.
Yeah, that was my
I
thing.
left it with
Yeah.
her.
I would have never even asked if she didn't, because I asked her to sit down and then she pulled them out.
Yeah.
I would have never even asked, hey, what's in your pocket?
Oh yeah, totally. Yeah, which is what we definitely need to, if she was just coming onto the unit, that type of thing, we need to know. And they, do, a full kind of assessment and they are taking things away in a real life situation. But, yeah, I mean, who knows? Maybe she had a visitor and someone snuck something in, we don't know how she got these things. And so, yeah, it's funny because everyone responds differently to that happening. Some people have like an immediate reaction and like are like no and takes it away, like even snatches it away, which we don't want to do, right? Some of you are like don't know what to do, so take a moment to collect yourself, and then like, hey, can I have that? And she's thankfully, willing to give it to you. And then some of you, like you said, you don't know what to do and you just let her have it, which we don't want to do either, right? Because that's not safe. So, had she responded differently to you asking her to take the cigarettes and alcohol, what if she had said, no, it's mine, and wanted to keep it? How do you think you may have responded?
Later was
Security.
Yeah, how do we respond to that? Like,
Yeah.
what's the correct answer? Like, what do we?
Yeah. So we always want to do like the least escalating thing right. Least invasive thing to, try and get, what is unsafe from our patient. So starting off by asking, hey, can I have that? When that doesn't work and you do see things kind of escalating, that is when you do need to, call for help and, go to your charge nurse, have them kind of come in. So you always have help. In the sim, it's hard because you don't have help, right? It's just you. But in a real life situation, don't be afraid to ask for help, especially if you're in that situation. And you are worried that your client is going to escalate if you keep trying to get it, which can happen, honestly, in a mental health facility, but really you probably see it more so in the med-surg facilities where patients come in with cigarettes, and I had a patient with a vape the other day. It's like you never know what they're gonna ring. So yeah, that is a challenging in no matter what situation. It's confrontational.
I was like, I can ask her to give it to me, or I can ask her if I can have some. And then I was like, I just asked her if I can have some of her cigarettes and her alcohol.
Yeah.
Like,
Some of you are like, no, I don't want any. But then some of you are like, hey, can I have some? It's just kind of whatever.
I was like, no, I don't want it. I'm like, oh no, if I ask for it, like I want to have one, she'll give me the whole thing. I'm like,
Yeah.
actually, yeah, I'll take one. Is this a trick question? Like, am I gonna say yes or no?
Yeah, for sure. Did you feel a need to correct the patient's misconceptions or delusions and present reality? And if so, how did you do that without challenging their beliefs and what their reality really was? I'll let Sam kind of share what she did, because I thought towards the end she did really well with kind of balancing that. If that's okay, sorry.
Yeah, sorry, I'm thinking now. I'm like, oh my god. Towards the end, we were making the bed, and then I asked her where we were when she said she was on the OR 410. And then I was like, well, I think I told her, I was like, well, no, like, I was like, we're in a hospital. I was like, I'm a student nurse at Temple College. I was like, so we are in a hospital, I was like, but we're like at a Temple hospital, not there. And then she's like, no, we're in Vietnam. And I was like, okay, well,
I am,
Yeah.
in 2025. So she did a really good job of being like, this is my reality. Like, I'm in 2025. I'm a student nurse. I'm at Temple College, without, putting the blame or, really kind of directing it at the patient. Where you're like, no, you are, here. We are here. Because you could tell, you can tell at some point the patient is not getting back to your reality. So, we want to be as gentle and mindful of that and have that like nice fine balance. Anything else that you thought did well with presenting reality or not well?
I let her live in whatever she was.
Yeah. Oh, and yeah.
I tried to tell her like a couple times, like, I'm not seeing it, but even if I wasn't seeing it, she would tell me to not step in the blood, I would still step over it.
Yeah.
Or like I would try to tell her like, well, I'm not seeing it, but what else are you seeing or hearing?
Yeah.
Like, describe it to me. And I would just try to gently tell her like, I'm not seeing that. To try to like present reality, but I wouldn't push it because I'm like, I think she's gonna get blood.
Yeah. So kind of again, having that fine balance between respecting what her beliefs are and trying to, be present in reality. How did you handle the patient's kind of disorganized speech and thoughts? She was going. She was talking. Yeah.
That's whenever I try to have her sit down.
Yeah.
Let's have a seat.
Maybe that will slow your
Right.
speech down. Yeah.
So in mine, I didn't necessarily notice any really disordered speech. Like, what she was saying made sense
Yeah.
in the scenario that was
she was
there.
in.
Yeah, so I didn't try to like redirect her. I said, down here, what are they saying? Where's the blood that I can't see? Where'd the blood come from? Oh, the blood's in the corner. Okay.
Yeah.
Some things like that, but I didn't try to like necessarily right.
I tried to make her feel comfortable. She asked me about lip gloss at one point, and I was like, didn't bring mine today, but I wish I would have.
Yeah.
And then I tried to make her feel like, because she thought she was training me, I was like, maybe if I'm just like cool with her, then she'll give me more than if I was like, why are you asking about lip gloss right now? Like, we're in the middle of an assessment.
Yeah.
And she was fixing her hair, and she was talking about Dr. Jane.
Dr. Jane.
So I was like, are you fixing your hair for Dr. Jane? And she's like, yeah, he's cute.
Yeah.
So I was like trying to relate and like girls girl.
Yeah, I'm like, she's a girl, I'm a girl, I guess we're gonna.
Yeah. I think a couple of you guys did that. Just kind of going on and seeing, if I get on your side, if we talk about the things you like,
Like
maybe,
building
yeah.
rapport or trust.
Yeah, building that rapport. Yeah, love that. I think a lot of you guys did a really good job of respecting the patient's personal space and autonomy. I think, so what is a command hallucination?
Tell you what to do.
So something, the voices are telling you kind of what to do. So, were you able to assess that for this client? And if you were, how did you do it?
Well, the charge nurse was telling her to get ready for the helicopter with a lot of soldiers. And every time she would go to that corner, it was like she would come back a little frustrated because it was like the charge nurse was like, they're coming, and she was like, I'm trying to get ready. But just, I didn't really question her a lot on the whole topic.
I think I asked what the nurse was saying. I
Yeah,
was like, oh, like, who are you talking to? And I was like, what are they saying?
right.
What do we
I
need to
asked
get
her
ready
how
for?
long she had been there. When she was talking about it, I was like, how long has she been here?
Yeah, how long have you been talking to her? Yeah. Did she tell you?
She's in her own world now. Like, okay.
Well,
Yeah.
I know she told me she was been there for 4 years. But I don't
Right.
I don't know if that was that location for 4 years.
Yeah. So really important in these kind of scenarios, right, that we are assessing for command hallucinations. So if your client is having auditory hallucinations, that we are asking, what are they saying? And it's not really enough just to ask them kind of one time. We really need to be reassessing to make sure that all of a sudden you are not the enemy and now she's going to harm you or she's going to harm herself. Like if we can't hear what they're saying, we don't know. So we have to ask, right? Did anyone do anything particular to decrease the stimulation in the environment?
That helped her make the bed.
Yeah.
You know, working with her split or something.
Try to help her with her tasks, but
What about medications? How did that go? Asking about medications.
She's not on it.
She's not on any.
She's not
Yeah.
on it.
She
She
told
works
me,
right past that.
she told me, I'm 20 years old. I don't take any medication.
I tried to ask, like, I didn't know who Dr. Jamie was. I was like, is he like in your head? Is he someone who actually comes into the room and helps you? So I was like, does Dr. Jamie give you anything? Because I'm like, I don't know, maybe she's gonna be like, oh yeah, every time he comes in here I feel great or something, or yeah, he
Right.
always brings me something.
Which is such a unique perspective. Like, this is the first time, since I've been doing this, that someone has had that perspective of Dr. Jamie not being in the war sim, but Dr. Jamie being someone that's working in the hospital, taking care of her, which is a good thought, which is, something that I think could be helpful to ask for sure. So I love that you asked that. What do you guys think as far as medications go that she, do you feel like she was maybe taking her medication? Would you give her any medications?
Definitely needs to be paired off. I don't know if she's on the risperidone.
Yeah, we don't know.
Or if it's at a therapeutic dose or effective, whatever.
Yeah.
Because is this a breakthrough or
Is it not working anymore, right?
Right.
And
Yeah.
just looking at her, you could tell like she's thinner. Like I feel like if you're gonna go into a patient, you can kind of just assess her physical features. Like obviously you know all the things that the effects are. If she had been on it long term, I feel like you can kind of pick out stuff to look at. Yeah.
If she doesn't look homeless, she looks well kept.
Mhm.
When you
Yeah.
talk to her about like, what would you live with, and she lives with her family in California.
Yeah.
So it's like, you call her family, I guess, and ask like, hey, what's going on?
Yeah, that's
Yeah.
another way to kind of get more information. Any other thoughts? Any other things that you guys think went well, or that you did really well, or that maybe you did not do so well, or that you wish you would have changed?
I went on to the Dr. Jamie thread online. Real talk. When I asked about Dr. Jamie.
Yeah.
That's how I was sure that it was just in the works, because I'm like, oh, who's Dr. Jamie? Oh, he's a surgeon. He does like, I help him out. We see each other. I'm like, okay, definitely in her head.
Yeah.
And she was very like, I'm trying to make a connection, like trying to be a little bit more. And I'm like, oh, I went through the right thread.
Yeah. So we'll go into kind of just applying what you guys have done today in the future. So what other situations might you face that would be similar to the situation that was like today?
Any schizophrenic patient?
No, sorry.
Wait, like,
So any patient.
oh, okay.
Or hallucination.
Could be like any, drugs.
So what types of patients? Yeah.
Schizophrenic patients.
Yeah. So what types of patients might have hallucinations or might have similar behaviors? That's fine.
Oh yeah, you see.
Good, yeah. So our older population that's confused, has altered mental status. Who else?
Brain injuries.
Brain injuries, yeah. Good one. I like that.
Anyone on any hard drugs or medication?
Illicit substances for sure. Who knows how they're gonna respond? Withdraw. Very good. PTSD. What else? What about like our dementia patients, right? Or maybe sundowning.
Oh yeah.
I know you guys, we haven't talked about cirrhosis yet, but those patients that are confused, have hepatic encephalopathy, or really any type of encephalopathy, lots of things can cause confusion, and can cause your patient to have visual auditory hallucinations. That you might use some of these same techniques to, de-escalate or prevent escalation of the situation, right? So what skills would you use in some of these other scenarios?
what do the voices say?
What are the voices saying?
So especially like on a med surg floor, like I think in this scenario, I was very prepared to come in and witness someone talking or seeing something that I didn't see. I walked in on the med-surg floor and, you know, my patient is, you know, talking to the window, I might not put all of that together and be like, hey, we might actually have a mental disorder, or we might be having command hallucinations or something like that. I might just be like, oh, I'm gonna let it keep on going.
Yeah, totally. Yeah.
You know, and
Now you have a different perspective.
yes,
Yeah.
definitely gonna stay closer to the door.
Yeah, honestly.
I'm going on the other side.
Yes.
Like, what do you do when you get trapped?
When you get trapped?
Yeah.
You
Call for help.
You need help. Yeah, you
Call
need
for
to
help.
be calling for help. You need
Staff
to-
say something.
Yes, staff assist. If you little thing on your little badge. Hopefully, if you have one of those. I actually was in a situation. It's horrible. It's really bad. I was the charge nurse on the floor, and it was like I was working night shift, so we were doing like central line dressing changes, and so I was in a patient's room doing a central line dressing change, which is a sterile procedure, right? And so the door was open, and all of a sudden I just see, you know, one of our more difficult patients like fly down the hallway. And again, it's the middle of the night. It's like 3 a.m. And the dressing was already off, so I literally have to finish what I'm doing, right, for the patient that I am taking care of. So I finished it really quickly. This patient made it all the way to the stairwell. Thankfully, there was other like nurses around. But a lot of you talked about your stethoscope when, you know, asking about what do I need to take for the stim. So the nurse that was there did have a stethoscope around her neck, and the patient was able to kind of like lunge for it. Thankfully, the nurse like had a very quick reflex, because I think both in our heads were like, oh my god, the patient's gonna grab it and go like this.
Yeah.
So thankfully, yeah, she was immediately like able to kind of take it off. And you know, at this point, like we're calling for help. You know, there's other nurses because it's quiet. Because again, it's the middle of the night. So there's nurses from the other
There is
floor.
security in there.
There's security. Yeah. There's security.
Somewhere on the
Yeah,
other side
so
of
like
the
a
building.
code is being, at this point the code is being called, there's people from other floors coming to help us on the stairwell because they hear the commotion. I mean, it's crazy. So again, like that's also part of the scenario is that, you know, in the scenario you're in a mental health facility, but really, you know, we're taking care of these patients anywhere. And so, yeah, that's why, you know, having these techniques and having this experience, even if you think that it didn't go the way that you wanted it to, at least now you have different things that you can kind of pull from and use. So, good. Does anyone think that you might do something differently in your practice because of this sim, or how this might change the way you care for our patients other than kind of what you said, which is a good example too?
I don't know. I'll deal with it if it comes up, but
It's tough. It's a skill, right? I mean, everything that you guys did today is a skill that takes practice, just like any other skill that you would be doing, starting IVs, doing blood draws. It all takes practice to get better at. So I thought you guys did really well. How are you guys kind of feeling now? Now that the sim is over.
Tomorrow.
Stress with paperwork, you got exams. Yeah. So how, you know, obviously the sim in itself can be very mentally and emotionally challenging. Nursing school is emotionally and mentally, physically, you know, sometimes physically challenging. And so is being a nurse, right? So these are kind of the things that we should practice. How do you practice self-care? How do you take care of yourself when you're in this type of situation?
Sleep after this.
Go to sleep, yes, some rest. Gym, yeah, exercise, super helpful.
The reflection paper, writing for like reflect on the day, jot it down.
I need kind of reflection. Well, hopefully with the extra time that you guys get back today, those of you that don't need to study can do something that fills your cup. That's kind of it for my debrief, but we'll take a look at the video. So one of you want to do the slides back there?